I am Dr. Rahul Gupta. I am a senior neurosurgeon at Fortis Hospital, Noida, near Delhi in India. Today we will talk about brain hemorrhage. We know about heart. Heart pumps the blood through arteries into various parts of the body or the organs, and that is the pure blood. And from various parts of the body or the organs, the blood comes back to the heart through the lungs, through veins. And lungs are known for purifying the blood. And that is how we live, how we walk, how we talk, and how we survive. This blood remains in the arteries and the veins, but when the blood pressure rises, these arteries or veins can rupture. And when they rupture, it leads to hematoma. And this hematoma, when it occurs in the brain, it is known as brain hemorrhage. There are various types of brain hemorrhages, where the blood is inside the brain parenchyma or the brain itself. Sometimes it can be at the base of the brain, and it is known as subarachnoid hemorrhage. Sometimes it occurs between the cranial vault and the brain and known as subdural hematoma. So all these brain hemorrhages can occur and are diagnosed with symptoms like sudden severe headache, weakness of one side of the limb or face, or vomitings, decrease in vision, or even loss of consciousness. So rarely there can be seizure as well. To diagnose brain hemorrhage, we have to do a CT scan of the brain. MRI can also help, but CT scan is the basic investigation to diagnose a brain hemorrhage. So when there is a brain hemorrhage, sometimes we require surgery if there is a large hematoma and there is a mass effect. But in majority of the cases, the hematoma is small and patient is conscious, but requires hospitalization and certain medication. Also, we have to look for the cause of brain hemorrhage. Patient can be on antiplatelets or anticoagulant therapy, or there can be sudden surge in the blood pressure, or there can be a vascular malformation. This vascular malformation can be diagnosed on angiography. This angiography can be of three types: MR based, CT based, or the gold standard, that is the DSA or digital subtraction angiography, and this procedure is done in the neurocath lab, and this is a very sophisticated machine which helps us to look after the vessels of the brain. So what are the various treatment options? The main option is surgery. So what are the various causes which can be treated by surgery? So if there is a vascular malformation due to aneurysm, we can open the skull, go inside and clip the aneurysm at the neck, so that there is no blood circulation inside the aneurysm and doesn't rupture again. If there is an AVM, we can go around it and excise it so that it doesn't bleed again. If there is a dural AV fistula, we can plug it. Some other small lesions can be cavernomas, which can again be excised. Now we have a new method of treatment that is known as the endovascular treatment, in which we go inside the artery and directly attack this vascular malformation by putting coils in case of aneurysm, by putting embolizing agent in case of AVM or dural AV fistulas. Or we have another mode of treatment, that is the radiosurgery. We can give radiotherapy to some of the small vascular lesions and we can burn the tissue. This can also help us to achieve the cure. So once these methods are done, we expect that there can be a cure. Certain difficult cases may not have a cure also. But what is more important? Most important is to keep our blood pressure normal. If blood pressure is high, the chances of rupture of blood vessels which are either aged or which are malformed is very high. So how can we keep our blood pressure normal? By doing regular exercise, eating a good food and having good food habits, also having a good sleep. Stress also increases blood pressure. If we can keep our stress under control, then also blood pressure remains normal. Still, some people suffer from familial hypertension. In that case, medicine is required, and regularly if we take the medication, blood pressure can be under control. So if we have good blood pressure and it is under control, we may not suffer from brain hemorrhage at all. So I wish you a safe and healthy life. Thank you.